So now we're going to talk about gonorrhea.
Right.
Because
gonorrhea is a sexually transmitted infection, and you can get it through sex, vaginal, anal, oral.
And it goes hand in hand with chlamydia. They tend to go together. Either it precludes it or it comes right after. The two go together. But regardless, it's the gold standard, so that's why we test for chlamydia and gonorrhea at the same time.
Right. Some of the signs and symptoms of gonorrhea can mimic chlamydia as well, but they're probably going to be a little bit more. Guys will typically have a quicker kind of discharge and sometimes copious amounts, a large amount of discharge as well. The girls may not, but they might have a funny odor, some pelvic pain, some
little greenish
urinating.
or yellowish discharge, if any. I've seen some women have a greenish, yellowish discharge. Definitely pelvic pain. And if you let gonorrhea go for too long, it feels like you're pissing razor blades. So that's the #1 way. If you feel absolute fire coming out, it could be a urinary tract infection, but the chances are that it could be gonorrhea as well.
Right, and the time of exposure for these can, again, like chlamydia, be as early as a day. Average is about 3 to 7, and again, can be about 3 to 6 months. But typically with gonorrhea, it's very potent. You're going to notice that you have these symptoms, so the best thing is to get tested.
Yeah, now gonorrhea can also sit in your throat or your rectum. So for this, you'll require a special swab. You might have to go to your normal healthcare provider for that, because over the internet, we're not able to provide that for you. So if you're getting a massive sore throat that doesn't seem to go away with normal medication or antibiotics, that's definitely something to go into your doctor for. And one of the tests that we use for gonorrhea at SxCheck is a PCR DNA. So it's a very early detection test by urine. So
it's a very sensitive test, and it can pick it up quickly.
Yes, very quickly.
Now let's talk a little bit about treatment. Again, treatment for gonorrhea, if you do come back positive, we'll definitely notify you. And it's a very simple round of antibiotics. You might take a couple of pills or a week's worth of pills, just depending on your allergies and so forth.
And make sure if you have any partner or partners that you let us know, because we want to medicate them also.
Exactly.